Top 30 Ambulance Cleaner Interview Questions and Answers. Working as an ambulance cleaner is a vital role in the healthcare and emergency services industry. Cleanliness and hygiene are paramount in ambulances due to the constant exposure to bodily fluids, pathogens, and high-stress environments. Interviewers seek candidates who are detail-oriented, safety-conscious, and understand the importance of sanitation in saving lives. This guide presents the top 30 interview questions with detailed answers to help candidates prepare confidently and effectively for their ambulance cleaner interviews. 1. What motivated you to become an ambulance cleaner? I was motivated to become an ambulance cleaner because I believe in playing a vital role in public health and safety. I understand how crucial a sterile and clean environment is in medical emergencies. Knowing that my work directly contributes to preventing infections and saving lives gives me a strong sense of purpose. I enjoy working behind the scenes to ensure ambulances are ready, safe, and clean for both patients and medical staff. 2. How do you ensure high hygiene standards in your cleaning tasks? I strictly follow disinfection protocols, use personal protective equipment, PPE, and apply hospital-grade cleaning solutions. I begin with proper ventilation, remove waste, disinfect all surfaces including seats, handles, and equipment, and mop the floors. I work systematically to avoid cross-contamination and always double-check to ensure nothing is missed. I also keep up to date with any new sanitation procedures or health guidelines to maintain the highest standards in hygiene. 3. What cleaning products are best suited for ambulance sanitation? For ambulance sanitation, I prefer hospital-grade disinfectants that are effective against bloodborne pathogens, bacteria, and viruses, such as quaternary ammonium compounds or hydrogen peroxide-based cleaners. These are effective yet safe for surfaces. I also use alcohol wipes for equipment and bleach-based solutions when necessary. Choosing the right product depends on the material and level of contamination, and I always ensure compatibility with medical equipment to avoid damage. 4. Describe your typical ambulance cleaning routine. My typical routine starts by putting on PPE. I remove all biohazard waste and dispose of it safely. Then I wipe down all surfaces with disinfectant, including stretchers, handles, seatbelts, and medical equipment. I clean from top to bottom to avoid recontamination. After surfaces, I mop the floor using a fresh mop head. Finally, I restock the ambulance supplies and complete a checklist to ensure no step is missed. 5. How do you handle biohazard waste safely? Handling biohazard waste requires strict adherence to safety protocols. I always wear PPE and use designated biohazard bags or containers. I avoid direct contact and seal waste securely. After disposal, I clean and disinfect the area and any tools used. I also label and store biohazard materials according to regulatory guidelines, ensuring proper hand hygiene throughout. I'm trained in OSHA standards, so I follow every precaution to minimize risk. 6. What safety measures do you take while cleaning? I wear full PPE including gloves, face masks, goggles, and gowns. I make sure the ambulance is ventilated and that I use cleaning products in a well-ventilated area. I avoid mixing chemicals and follow the manufacturer's instructions. I use caution when handling sharp or hazardous objects and dispose of biohazards properly. I also keep pathways clear to avoid slips or falls. Safety is my top priority in every task. 7. How do you prevent cross-contamination during cleaning? To prevent cross-contamination, I clean in a systematic top-to-bottom and clean-to-dirty direction. I use color-coded cloths and fresh cleaning supplies for each area. I change gloves frequently and dispose of any contaminated materials properly. Equipment is disinfected between uses, and I avoid touching clean areas after handling dirty surfaces. I also train regularly on hygiene protocols to stay current and ensure thorough prevention of cross-contamination. 8. Have you ever encountered a difficult cleaning scenario? How did you handle it? Yes. I once had to clean an ambulance after a serious trauma case with heavy biohazard contamination. I followed strict biohazard protocols, wore enhanced PPE, and used high-level disinfectants. I methodically cleaned and disinfected all affected areas multiple times. It took extra time and focus, but I ensured every surface was safe and clean. I reported the incident per protocol and restocked the ambulance carefully for its next use. 9. What PPE do you use while cleaning ambulances? While cleaning ambulances, I use gloves, a gown or coveralls, safety goggles or a face shield, and a face mask or respirator if needed. If there's heavy contamination, I use boot covers and double gloves. PPE is essential to protect against pathogens and hazardous chemicals. I also ensure that all PPE is disposed of correctly after use, and I thoroughly wash my hands after removing each piece of equipment. 10. How do you deal with strong odors in the ambulance? I identify and clean the source of the odor first, usually bodily fluids or waste. I use enzymatic cleaners and disinfectants specifically designed to neutralize organic odors. I ventilate the ambulance well and may use odor-neutralizing sprays if necessary. However, I avoid masking the smell without cleaning the cause. My priority is to ensure the ambulance is fully sanitized and odor-free for the comfort and safety of the next patient. 11. How do you handle time pressure when multiple ambulances need cleaning? In time-sensitive situations, I prioritize based on contamination level and upcoming use. I use a structured checklist and cleaning routine to stay efficient. I communicate with dispatch or supervisors to coordinate turnaround times. If needed, I work with a team and delegate tasks. Despite the urgency, I never compromise on quality and always follow protocols to ensure patient safety isn't at risk. 12. Are you familiar with any health regulations or standards? Yes, I'm familiar with OSHA standards, CDC guidelines, and local health department regulations. These standards guide how to safely handle biohazards, disinfect surfaces, and use PPE. I also follow ambulance service policies on infection control and sanitation. I stay updated through regular training and ensure my work aligns with both legal requirements and best practices to maintain a clean and safe environment. 13. How do you ensure medical equipment isn't damaged during cleaning? I use manufacturer-approved disinfectants and follow care instructions for sensitive equipment. I avoid soaking or spraying directly on devices and instead use disinfectant wipes when possible. I check equipment labels for compatibility and clean gently to avoid damage. I also report any issues to the appropriate medical staff. Being cautious and informed ensures both cleanliness and the longevity of medical tools. 14. How do you manage supplies and inventory in your role? I keep a daily log of cleaning supplies and PPE usage. I regularly check stock levels and request resupplies before items run low. I follow a first-in, first-out method to ensure products don't expire. I also inspect the quality of supplies and make sure everything is stored safely and in designated areas. Efficient inventory management ensures I'm always prepared for thorough ambulance sanitation. 15. How do you stay updated on new cleaning protocols? I attend regular training sessions provided by the employer or health authorities. I also review updates from the CDC, WHO, or OSHA. I communicate with supervisors or infection control officers to learn about changes. Reading manuals, watching tutorials, and discussing with peers help me stay informed. Staying current ensures that I provide safe, effective, and compliant cleaning services in dynamic healthcare environments. 16. How do you handle stress in this job? I handle stress by staying organized and focused on the task at hand. I take deep breaths, maintain a positive mindset, and remind myself that my work contributes to saving lives. Time management and teamwork help reduce pressure, especially during busy shifts. I also make sure to take proper breaks when allowed, practice good self-care, and communicate effectively with colleagues to create a supportive and efficient work environment. 17. What would you do if you noticed a fellow cleaner not following protocols? If I noticed a fellow cleaner not following protocols, I would address it professionally and discreetly. I'd remind them of the correct procedures, emphasizing safety and the importance of compliance. If the issue persisted or was serious, I'd report it to a supervisor to prevent any health risks. Patient and staff safety is critical, and everyone must adhere to standards. It's better to prevent an issue than correct one after exposure. 18. Are you comfortable working with bodily fluids and biohazard materials? Yes, I am fully comfortable working with bodily fluids and biohazard materials. I understand it's a core part of the role, and I'm trained to handle these materials using PPE and safety procedures. I don't feel squeamish because I stay focused on the importance of sanitation and infection control. I take every necessary precaution and treat every cleaning situation with the same level of seriousness and professionalism, regardless of severity. 19. Describe a time when you worked as part of a cleaning team. I once worked as part of a team during a large-scale emergency where multiple ambulances required deep cleaning. We divided tasks. One person handled waste disposal, another did surface disinfection, and I focused on equipment and restocking. Communication and coordination were key. We completed all units efficiently without compromising standards. It was a great example of how teamwork helps maintain high quality even under pressure, and it reinforced the value of cooperation. 20. How would you respond if you found a medical instrument left behind? If I found a medical instrument, I would stop cleaning immediately, avoid touching it directly, and report it to medical staff or my supervisor. I'd ensure it's safely collected and decontaminated by appropriate personnel. Then, I would resume cleaning after proper clearance. It's important not to tamper with medical instruments to avoid contamination or misuse. Following protocol ensures safety for everyone involved and maintains professional standards in the ambulance. 21. What's your experience with infection control procedures? I have hands-on experience with infection control procedures, including cleaning and disinfecting surfaces, handling biohazard waste, and preventing cross-contamination. I've been trained in universal precautions and understand the importance of wearing PPE, using proper disinfectants, and documenting cleaning activities. I also know how to identify high-touch areas and prioritize them in cleaning routines. My goal is always to eliminate infection risks in the ambulance environment to protect both patients and medical staff. 22. How do you prioritize your cleaning tasks? I prioritize based on contamination risk, ambulance usage schedule, and safety. I start with the dirtiest or most critical areas, like stretchers and handles, then move to less frequently touched surfaces. I also follow a top-to-bottom routine to avoid recontamination. If multiple ambulances need attention, I consult with dispatch or supervisors to address the most urgent needs first. Prioritization ensures both thorough cleaning and timely ambulance availability. 23. What would you do if you accidentally got exposed to a biohazard? If exposed, I would immediately follow exposure protocols. Remove contaminated clothing, wash the exposed area with soap and water, and report to a supervisor. I'd seek medical evaluation as required and fill out an incident report. It's critical to act quickly and responsibly to reduce any health risks. I understand the importance of documenting exposures and following up as needed to protect myself and others from further harm. 24. How do you manage your time during a busy shift? I use a checklist-based system to stay organized and ensure nothing is missed. I group similar tasks together to save time, such as disinfecting all surfaces before restocking. I assess each ambulance's condition to decide which ones need deep cleaning versus quick sanitization. Clear communication with dispatch helps with planning. Time management helps me remain efficient without compromising cleaning standards, even during back-to-back calls or emergencies. 25. What qualities make you a good ambulance cleaner? I'm detail-oriented, reliable, and understand the importance of hygiene in saving lives. I follow procedures exactly, work well under pressure, and maintain composure around biohazards. My commitment to safety, teamwork, and efficiency makes me effective in my role. I'm also a good communicator and always strive to improve my skills. These qualities help ensure that ambulances are cleaned to the highest standards every time. 26. Have you worked night or weekend shifts before? Yes, I've worked both night and weekend shifts in previous cleaning roles. I understand that emergencies happen at all hours, and I'm flexible with scheduling. I adjust my routine and maintain the same high cleaning standards regardless of the time. I'm used to being alert and focused even during overnight shifts. I also understand that teamwork and communication are even more important during less staffed hours. 27. How do you clean after a patient with a contagious disease? I follow enhanced infection control protocols, including using hospital-grade disinfectants effective against viruses and bacteria. I wear appropriate PPE such as gloves, gowns, and a mask or respirator. I focus on all touch points and high-risk areas, allow disinfectants proper dwell time, and safely dispose of all contaminated waste. I clean all equipment and restock with sterilized supplies. Finally, I document the cleaning and notify the supervisor if any concerns arise. 28. How do you restock medical supplies in the ambulance? I use a checklist to restock medical supplies, ensuring that all necessary items like gloves, bandages, oxygen masks, and cleaning wipes are present. I replace expired items, organize supplies for quick access, and confirm quantities. I also report any shortages or damages to the supervisor. Keeping the ambulance fully stocked and orderly is essential so that paramedics can find what they need immediately in emergencies. 29. What steps do you take before beginning your shift? Before my shift, I check the schedule and ambulance assignments. I inspect my cleaning equipment and make sure PPE is available. I review cleaning checklists and any special notes or alerts regarding recent calls involving contagious diseases. If necessary, I refill cleaning products and prepare my workspace. Preparing thoroughly at the start of a shift ensures I'm ready to handle tasks efficiently and safely. 30. Why should we hire you for this position? You should hire me because I'm dedicated, reliable, and trained in professional sanitation and infection control. I take this role seriously, knowing that my work impacts patient outcomes and paramedic safety. I follow procedures rigorously, communicate well, and stay calm under pressure. My experience, attention to detail, and strong work ethic make me a perfect fit for maintaining the high cleanliness standards required in emergency medical environments. Ambulance cleaners play a critical role in the emergency medical system, ensuring that ambulances are safe, sterile, and ready for the next call. Interviewers look for candidates with strong attention to detail, excellent hygiene knowledge, and the ability to work under pressure. With these top 30 questions and answers, you can confidently showcase your skills and professionalism. Preparation is key. Review protocols, practice your responses, and show your dedication to health and safety in every answer.